Yeah.
I mean, so you've mentioned several times, when kids have sleep problems, obviously as a sleep medicine physician, you're thinking about what could this be other than behavioral? And I guess the question is like, how do you know if there's a medical problem causing their sleep issues?
Yeah, that's a great question. So, um, a lot of times, children that do have medical sleep problems will have some kind of manifestation. One thing that even apart from the broad categories of medical sleep problems like sleep apnea, where you have partial collapse of your upper airway and your child is snoring and may have some either pauses in their breathing, usually you will hear that. So one thing I say is if you have a child who is snoring outside of colds and
Mm,
outside of like allergy season, and they're snoring anywhere from 3 to 5 times a week, that should not happen. So you should have them seen by your physician because that way they can either get a sleep study and things like that. So the snoring is something we may see, or really, really restless sleep, choking or gasping, things like that. So if you're
mm,
seeing that outside of them just having a typical cold, then you may want to pay attention. And then, or if they're waking up and they're just so exhausted, so they've had a decent amount of sleep at night, but they're still tired,
mhm.
or they're complaining of headaches and things like that. Those are cues or clues that your child might have a sleep problem. And so that's for sleep apnea.
Okay.